this is Madhumita, final year MBBS. Let's see topic from Paediatrics, Necrotizing Enterocolitis. Necrotizing Enterocolitis. It is a life-threatening gastrointestinal emergency condition. It is most predominantly seen in premature neonates. Etiopathogenesis, first one is most important one is prematurity, less than 32 weeks. There will be immaturity of GI tract. It will cause inflammation necrosis. Top feed, other than breast milk are called as top feeds. Formulated milk, cow's milk, in that it contains a bacterial colonization. Due to lack of breast milk, the patient will be less immunity. It has a less immunity. Due to this infection, it causes inflammation necrosis. Then other reasons are asphyxia and maternal cocaine use. It will cause a vasoconstriction. It will reduce the blood flow to the mesenteric artery and it will cause necrosis. These are the etiology causing NEC. Now let's see the staging, modified Bell staging. Now let's assume this is the intestinal loop. This purple color is a lumen. This outer wall. This outer wall is a wall of intestine. The inner wall is the epithelium of intestine. This red color dots represents a bacterial colonization. First stage 1 is in stage 1 the bacterial colonize in the lumen and it will reach up to epithelium of intestine. So it will cause non-specific symptoms like vomiting, abdominal distension. So the stage 1 is known as suspect NEC. Suspect NEC. Now stage 2, the colonize on a bacteria இப்போ epithelium of intestine break out பண்ணும். Break out ஆயிட்டு lumenல இருக்க hair will reach the wall of intestine. In this இப்போ நம்ம ரேடியோலஜிக்கலாக நம்ம இப்போ பார்த்தோன்னா pneumatosis intestinalis இந்த ஃபைண்டிங்ஸ் ரேடியோலஜிக்கலாக நம்மளால் ஃபைண்ட் பண்ண முடியும். Air in the intestinal wall is called as pneumatosis intestinalis. Okay, it is a definite NEC. இந்த ஃபைண்டிங்ஸ் இருந்துச்சுன்னா டெஃபினட்டாக NECன்னு நம்மளால் டயக்னோஸ் பண்ண முடியும். Now the stage 3 is a complicated NEC. இங்கே என்ன ஆகும்னா இந்த கொலனைஸ் ஆன பாக்டீரியா இந்த ஹேரும் என்ன ஆகும்னா வால்ஸ் ஆஃப் த இண்டஸ்டைனை பிரேக் பண்ணி பெரிட்டோனியல் கேவிட்டியை ரீச் ஆகும். ஸோ நவ் த ஏர் அண்ட் பாக்டீரியா இந்த பெரிட்டோனியல் கேவிட்டி அது என்ன கண்டிஷனை காஸ் பண்ணுன்னா pneumoperitoneum and peritonitis. This is the 3 stages. Stage 1 is a suspect NEC, stage 2 is a definite NEC, stage 3 is a complicated NEC. These are the clinical features. Feeding intolerance, abdominal distension, vomiting, abdominal wall edema, bloody stool, abdominal tenderness and erythema, visible bowel loops will be present. Now we can see the features in a tablet form. Suspect NEC, definite NEC and complicated NEC. The suspect NEC divided into 1A and 1B. 1A the features will be occult blood in the stools. The radiological imaging will be normal. And 1B the gross blood in stools, the radiological imaging will be normal. In 2A and 2B the absence of bowel sound will be present. In 2B bowel sound, absence of bowel sound plus abdominal edema will be there. In this 2A we can find the definite feature Necrotizing intestinalis. It is a definite feature in NEC. In 2B it will present Necrotizing portalis. What is meant by அப்படினு பார்த்தோம்னா air intestinal wall it enters the venous drainage, it will reach the superior mesenteric vein. The superior mesenteric vein drains in portal vein. In air in the portal vein is called as Necrotizing portalis. This is a complicated NEC. Is divided into 3A and 3B. In 3A, what are the features we find is induration, redness or erythema and tenderness of abdominal wall. In 3B, the intestinal perforation is a feature. Radiological imaging will be pneumoperitoneum. It is very important. Now we can see the management of NEC. In clinical lab findings, we find the triad of lab finding. It will not helpful in diagnosis. Diagnosis help பண்ணாது, but it is in exam point of view it is very important. Thrombocytopenia, hyponatremia, metabolic acidosis. This is a triad of lab findings seen in NEC. This triad will be seen from stage 2B. Now up to stage 3A, the medical management is more than enough. Nil per oral, total parental nutrition, IV antibiotics will be given. Covers gram positive, gram negative and anaerobes. Penicillin, aminoglycoside, metronidazole. The duration of antibiotics will be 1A will be given 3 days. This is a mild condition. 1B will be given 7 to 10. We consider as moderate. 2 and 3A is a severe condition. So it is a 14 days we should give antibiotics. Now we can see the management for stage 3B. It is a complicated NEC. If the patient is hemodynamically unstable, we should perform the emergency procedure. It is the primary peritoneal drainage. After the patient will become stabilized, we can undergo laparotomy and resection and anastomosis as done. Untreated NEC is the main causes of neonatal mortality. Let's see the MCQs from this topic. Which of the following radiographic finding is a pathognomic and hallmark of NEC? It is a nematosis intestinalis. Next, the Bell's modified staging, which sign indicates a stage 3B NEC? It is bowel perforation and peritonitis. In NEC management, the first step when you suspect NEC is keep nil per oral and broad spectrum antibiotics. Which of the following statements is true regarding NEC? Mortality in NEC can up to 50%. I hope this video will be very helpful for you. Hit a subscribe button and stay connected with Med with M Square.